Chitis Karki is lucky to be alive. 12 days after the birth of her child, she started bleeding heavily. With the help of hired porters, Chitis's husband carried her here, the only hospital in the district. Where we live, there are no doctors or medicines, her husband says, and the government health workers at the public clinic are rarely on duty.
डाक्टर भए तर हाम्रो हामीले यति टाढा किन आउनु पर्यो हामीलाई 4 घण्टा लाग्छ त्यहाँबाट डोको काटेर डोकोलाई बुनेर डोकोमा बिरामी राखेर बिचैमा कतिपय त बिचैमा नि मरेका छन् मान्छेहरू स्ट्रेचर पाइन्न सामान्य एउटा हस्पिटल ल्याउने एउटा स्ट्रेचर दुई जनाले बोक्ने स्ट्रेचर भए त अझ राम्रो थियो स्ट्रेचरको पनि व्यवस्था छैन डोको काटेर ल्याउनु पर्छ.
We barely make enough farming, he says. If the money is not enough for this treatment, we will have to take a loan. Stretched between the flat plains of India and the high mountains of the Himalayas, Nepal is a country of plunging valleys and wide rivers, often making communication, let alone travel, difficult. Though steeped in rich culture, with diverse ethnicities, Nepal is one of the world's poorest countries. Deprivation is most widespread in the western regions, where the average person doesn't live much beyond 60, and malnutrition among children is high. From the Nepalese capital, it can take 2 or more days by road to reach this part of the country. People here say that for as long as they can remember, basic health services have largely failed to reach most of their villages and towns. And while the government has constructed a network of village-based facilities called sub-health posts, trained staff are reluctant to live outside urban areas, and people trek for hours to their local sub-health post, only to find that often staff are absent and medical supplies inadequate. Over the past decade, the situation here has become even worse. In 1996, the Communist Party of Nepal, Maoists, launched their People's War. Slowly this conflict engulfed much of the country, but it was most intense where it began, in the western regions. Many buildings, including health facilities, were either damaged or abandoned, becoming ghostly playgrounds for children. Some government employees, including doctors, nurses and other health workers, fled the region, and in many places medical supplies completely dried up. Easily treatable illnesses, like diarrhea in children, began taking more and more lives, while stories like Chitis Karki's became all too common. The deteriorating situation in Nepal's western regions raised grave concern among humanitarian organizations.
Health services in Nepal, they have been traditionally weak, and the war made it even worse. When we did the assessment, we realized that people were dying now from the most common illnesses. And not only the poor health impact as well on the well-being of the family, on the economic status, so it impacts far beyond health itself.
With funding from the European Commission's Humanitarian Aid Office, the International Rescue Committee, in close collaboration with the government, rolled out a project aimed at restoring and strengthening 15 sub-health posts.
Nepal government र त्यो युनिटलाई सकेसम्म स्ट्रेंथन गर्ने, बढी manpower दिने, त्यो बनाउने अनि logistic supplyहरु बढी होस् अनि त्यो किसिमले अहिले सपोर्ट सबैतिरबाट होस् भन्ने किसिमको यो स्ट्र्याटेजीहरु डेभलप गरेको छ. त्यसै अन्तर्गत डोनर संस्थाहरुसँग धेरै रिलेसन राखेर क्लोज रिलेसन कोअर्डिनेसन गरेर.
The new project sought to benefit more than a quarter of the people living in Surkhet, a district in one of Nepal's most conflict-affected regions. An immediate priority was improving sub-health post buildings.
Well, because of the poor condition of many sub-health posts, people felt that they couldn't rely on services there and as a result stopped using them. without properly functioning health posts, people would wait until the very last minute before seeking medical help. And this meant that all too often treatment came too late.
With funding from ECHO, IRC repaired 1/4 of all the sub-health posts in Surkhet, also fitting water taps and toilets where needed. An initial assessment carried out by IRC revealed that 60% of the sub-health posts in Surkhet had inadequate supplies of medicines. To replenish these and other supplies, IRC delivered much-needed drugs and basic medical kits, often having to carry these items for hours, if not days, to outlying sub-health posts. This was not simply a one-off donation, rather a way for communities to restart their revolving medicine funds. Under this government scheme, medicines are sold at cost price, and the money collected is used to restock drug supplies as needed.
Well, we are delivering a life-saving intervention. We are also trying to ensure that communities get actively involved because we believe that this is the only way for our work to have a lasting impact. So one approach is providing communities with the capital in the form of medicines, enabling them to reinvest and ultimately establish a steady supply of medicines to their local sub-health posts.